You're listening to Coupled With, the podcast that helps you take the guesswork out of feeling seen, heard, and valued in your relationship. If you've ever felt stuck in the same arguments, struggled to stay connected, or wondered how to better communicate with your partner, you're in the right place. I'm Dr. Rachel Orleck, a couples therapist and coach, and together, we're going to make relationships make sense. Let's dive in. When something is physically or emotionally painful in a relationship, it's easy to feel like you're facing it alone. But what if it wasn't just an individual journey? What if it could actually bring you and your partner closer? Today I'm joined by Urvi Shah, who shares her Today I'm joined by Urvi Shah, who shares her deeply personal story of healing from vaginismus, how it impacted her relationship, and how she and her partner were able to find their way back to intimacy, trust, and connection. We also talk about the role spirituality played in her journey, not just in self regulation, but in rebuilding their emotional bond and creating a foundation for their future. If you or someone you love has ever struggled with intimacy, felt disconnected from your partner, or wondered how healing can happen in relationships, then this conversation is for you. Let's get into it. Hi, Urvi. Welcome to the show. We're so glad that you can make it here.
Thank you so much, Rachel. I'm so happy to be here and so excited to share my story.
So, you have a really interesting story. You're also a coach for women going through infertility and motherhood, and you've had your own personal journey through all of those realms. Can you share a little bit about what your journey has been like to this point?
Yeah, sure. It's been a long journey. So about 9 years, 8.5, 9 years until I finally became pregnant and now I have my son. Um, but it started off originally, and this was probably year two of my marriage, when I started to really think about like, okay, I want to be a mom. Like, what are the steps I need to take? And so, um, I started to really go and meet with like different gynecologists to kind of understand uh, my own body, my own, state of like pregnancy. Like, can I get pregnant? Like, am I fertile and all of those things? And, um, I remember the very first gynecologist I went to go visit. Um, they were doing some exams and I had a lot of pain with the exams. And she's like, this is not normal, but she didn't make me feel safe about it, and so I just kind of clammed up and was like, "Okay, I'm not gonna do this. Like, I'm not like, forget it. Like, we don't need to have kids." And, at that time, my husband had a traveling job, and so he was pretty much traveling, I wanna say, like, 80% of the year, and so I was
Wow.
primarily by myself, right? And so in my head, I'm like, "Alright, well, he's not even here, so how are we even gonna try to have kids? Or, like, how is it even gonna work out if I do become pregnant?" And, um, I was kind of, like, making up stories in my own head of, like, why I don't want to become pregnant, um, but it was really a way for me to not face my fear of actually understanding the situation that happened. Fast forward, I finally was like, okay, I really need to figure out what's going on. Like, why am I having pain? And I always had pain with any sort of like insert or like penetration. I just never knew what it was. And so I finally went to a gynecologist that was recommended to me from a friend. She was much younger and like she was just like, okay, well, there's a condition called vaginismus and you have it. And I'm like, okay, what is this? And I remember like talking to her, and at least I understood what I had, but like it was still equally crushing for me because um, I just remember her saying, like, having kids may be difficult. And for me, in my mind, that translated to I'm not having kids. Even though she said could be difficult, I didn't really focus on those operative words. I just focused on difficult. And for me, I was just crushed. And so I cried in the car um, for a
What is it
while.
about vaginismus that makes it difficult for you to have a kid?
So vaginismus is the condition itself is like the vaginal walls start to and the muscles around it start to contract when anything penetrates through. So naturally, obviously, naturally trying to conceive requires you to have sex, and like that's the whole process of it. And so that wasn't something that was available until I cured that. But then even other things, right? Like even if you were to go to exams and things like that, like you would have to go through a process of things being inserted inside of you in order for you to, like ultrasounds and other things. And so um, I I think for me it was like very crushing to hear like, okay, well, I'm gonna have to get through this first before.
Of
Um,
course.
and I didn't know how to tell my husband. I didn't know like what to do. I was very ashamed of it. Like I kind of felt like, why me? Why is this happening to me? I didn't even know that it's, other women could have it. Like I kind of felt very isolated at the same time.
It's not something a lot of people talk about, but it's actually quite common.
Yeah, it's cool. After I learned that, I was like, "Oh, there's actually a lot of women that do have this and they go through it." And I started to find hope because I started to become part of these support groups where women were talking about getting pregnant, even though they had vaginismus and the ways that they were getting pregnant and stuff. And so, um, the first part of all of it was getting cured, and so I started going to pelvic floor therapy, and my pelvic floor therapist was she was amazing. Like she had this natural gift of just keeping me calm. And a lot of the things that we practiced was mindfulness, along with understanding like the muscles of not only the pelvic floor, but like the hip, all of the other muscles that are connected to the pelvic floor that were tight for me. Right. And so
Mm.
I started to understand like everything connected and like it's connected to my breath. And um, that opened a whole different world for me at that time.
Pelvic floor physical therapy is so important. I feel like any woman listening to this who has ever been pregnant, ever wants to be pregnant, is currently pregnant, should absolutely get pelvic floor physical therapy. It helps with vaginismus and pain. It helps with making sure you don't have urinary leaks when you're pregnant or post pregnancy. We think about them being really loose, but they can actually get really tight, which is what you experienced.
Yeah, really tight. And I think the other part that I want to mention in terms of connection is the mind body connection. So,
Yeah.
a lot of what vaginismus and healing vaginismus taught me was like how my mind would automatically create a story before a situation or a stimulus would happen, right? Like, so before I inserted something, like my mind would be like, this is going to be painful. And then it was painful. And it was like
Yeah.
a lot of that awareness that I started to create. Which obviously helped me in creating awareness in other areas of my life too. Um, but I started to realize like, oh, okay, well, if I just like stay calm and like breathe and do these breathing exercises and like really relax my muscles and then start to do other exercises, like of inserting like the dilators and things like that, it doesn't hurt. And like then I started to become very curious about it, like, okay, what is this? And so I started doing a lot of research and like mind body connection and what is this? And like it's just like a whole different world was just open to me. I started to like dive into this other world of not only spirituality, but mind body connection, emotions, how emotions are part of all of this. And then just energetic work.
That's such an important point. I used to be a health psychologist, and when I was doing that, I worked a lot around chronic pain and how pain, while we feel it physically, is really something that's in the mind, assuming there's no injury. And our experience of pain can be really different depending on how we believe it will be, depending on how we see it, if we see it as dangerous or if we see it as normal. It can really impact how we experience that pain.
Yeah, absolutely. And I think that not only that, but I feel like when we bring the awareness to understand that connection between the mind body, we start to take ownership of our own life. Like for a long time, I think the theme that I kept playing in my head was like, I'm a victim of this disease or this condition, right?
Mm.
And then I started to realize, like, I'm not a victim, actually. Like, I actually have a lot more control than I know I have. Um, of certain situations, of the pain, of like, I can really cure this and heal this myself, but I have to take
Amazing.
that ownership. And I think that that journey taught me that. But then, like I said, like I could transfer that to so many different other areas of my life.
As you were going through that journey and you were experiencing that pain, how did that impact your relationship with your husband?
So we definitely took a journey. So like I said, my husband traveled a lot for work at that time. And I remember the day that I found out about my vaginismus. I didn't even tell him for about a week. Um, and fast like actually rewind. Me and my husband, before we started dating, got married, we were like really good friends. And so our relationship was based, like, the foundation was this friendship, and like that friendship was based on like the trust and this very openness that we had of sharing everything that we were going through. And so for me to not share anything with him for a week was a very big deal.
Mm.
um and it was weighing on me, and I was like, okay, I just need to tell him. And the reason why I didn't tell him was because I felt very ashamed. I felt like, one, I felt like, okay, like at that time I didn't know, like, okay, why is this happening to me? And he probably doesn't want to be married to me anymore because I have this condition. I felt like, okay, well, he's going to learn this, and then maybe he's going to think that we won't be able to have any intimacy in our marriage, and like that might lead him to like everything in my head was like he's going to leave me when I tell him, right? Like I was making up all of these stories, and like for a while, I was like, "Okay, I'm not gonna tell him," and I was like, "I have to tell him because, like, not telling him is not also solving anything for me." And, I told him, and he was very supportive of it. He's like, "What do we need to do?" And I was like, "Well, we don't really need to do anything." It was me, and I became very, like, angry and resentful. So, I think that for about a year or 2 years, I didn't even talk about, like, having kids. If the topic was brought up to us, I would just, like, become very, closed off to even discussing it. I wouldn't discuss it with him. Um, it was really eating me up from inside, and I think a lot of that weighed on our marriage as well because I just kind of pushed him away, um, even after I told him I had this condition, because I felt like a lot of it was for me to solve, and, like, he was fine, like, he didn't have anything wrong with him. I had to figure this out, I had to solve it, it was all on me, um, and I kind of, like, was a little slightly jealous of him, like, that he didn't have to go through this, until I realized that, like, he was actually trying to be there to support me. And so, I remember when I started going to the pelvic floor therapist, um, she had talked to me about, like, "You need to get him involved in the process." You just need to talk to him and open up the communication again and, like, feel safe with him because that's, like, the very first part of vaginismus and, like, healing from vaginismus. And so I started to include him. Even if he was traveling, he wasn't home, I would call him and be like, I went to the pelvic floor therapist. This is what we did. This is how I feel. This is what came up." And that started to grow our relationship back together in terms of intimacy as well.
Uh,
Um,
there was this process that you went through where you started telling yourself that being close with your husband was no longer safe. Your body remembers that. There's more pain when you're then intimate. It's scary to open up. And then it sounds like there's this additional component of of telling yourself that you're the one that's broken, you're the one that needs to get fixed, and both feeling a lot of shame about that, but then also feeling kind of angry and resentful that you're going through this alone and he's okay, which
mhm.
I think is a really common story for, I'll be heteronormative, but women in relationships as they're going through their journey to get pregnant, especially if they're having difficulty. It seems like a lot of the work ends up being on the female or the person who will be the intended pregnant person's shoulders.
Yeah. Yeah. And it was also, I think, because he was traveling, I always had this story in my head of like, okay, well, it's so much easier for him to cheat on me or to leave me or to like not be around, right? Because he was physically with me every day. And so I thought that he just doesn't want to be part of it. Um, not not knowing that like that's his job, that's what he does. It's not like it's like his choice to like not be home.
Right.
Um, and those stories I was creating in my head created a space of like me not feeling safe even in my own body because I just hated myself and my own body. Um,
Oh,
which
that sounds so hard.
which amplified the fears that I had. And it took me about from the day I found out I had vaginismus to the day I actually went to seek help for it was 2 years. It was a
Wow.
span of 2 years for me to actually take the action of going to a physical therapist and saying, I want to get cured for that. And for those 2 years, I was living with all of those thoughts and all of those emotions and feelings. And, you know,
That's such a long time.
yeah, yeah.
So what was the next step as you started to heal from the vaginismus and you were working with your husband, you finally started letting him in. How how did your journey progress from there?
Yeah. So, once I started going to pelvic floor therapy, it actually progressed very quickly. I went to therapy for about 4.5, 5 months. I was very committed to doing my homework, doing whatever she said at home, which really helped. And during that time, those 6 months or 5.5 months that I was with her, I brought a lot of awareness in my own body, in my own spirit, even where I opened up channels, I think, spiritually, um, which allowed me to see life in a very different way. I think a lot of it was also letting go of like this pent up energy inside of me. Like for such a long time, I was holding this energy of feeling ashamed, feeling like the victim, feeling angry, feeling resentful. And I started to really let that go and um, allow love in my heart, I think. Like, I just
Mm.
allowed my heart to open and feel the love that was around me, and a lot of that was from my husband. Like, I started seeing him in a different way, like, "Oh my god, like, he's still here, like, he's still with me, supporting me, he's doing these exercises with me, like, he's coming with me to, like, appointments that I need to go to." And I think that really allowed me to open up even more in our marriage, to just be I think me opening up in our marriage really created this closeness that we didn't have before.
So as you became more aware of your own spirituality, your own openness, your own inner world, it really helped you find ways to connect with him even more.
Mhm. Yeah. And I think a lot of it was also, like, I realized, like, the stories I was making
Mm.
and how that portrayed like in my reality, right? And so it's like I'm creating these stories, I'm saying all these things about him which are not true. But I'm seeing it happen because I'm saying these stories and they're actually happening because that's what my reality is showing me, right? And when I stopped doing that and I stopped um, creating stories, but actually just being open to letting things unfold and just being curious about like, wonder what this is about, and like not actually creating something, but like just letting it happen. That's when I started to really open up to him and like seeing how much he really loved and cared for me.
That curiosity that you spoke of, I think, is really important because we jump to conclusions. I call it our filter, the way we see the world, the way we've been programmed from our past, the things that we've experienced. We have this filter that we see the world to make meaning of what's happening,
Mhm.
but we don't often consider what is going on for the person that we're seeing that we're making meaning of. So in this case, you and your husband. And when we can sit back and just be a little bit more curious about it, not even benefit of the doubt, just being more inquisitive and I wonder what this is about. What is it that I'm seeing? Then
Mhm.
we start to see what's happening for the other person and how we have more potential to connect with them.
Mhm. Yeah, it was about dropping my judgment. I think I had a lot of judgments about the marriage, about him, about what he cared for, he didn't care for. And I think when I was able to become very non-judgmental, but curious, like not just like, I'm not judging you at all. It was just like from judgmental to curious. I was like, okay, I'm going to see what happens today. I'm going to see how he reacts to this and like allow him to be himself. I think it also took pressure off of him because Obviously, he's also part of this relationship. So, like,
Sure.
whatever I'm throwing at him, he's reacting to, which is creating a dynamic between the two of us, right? It's creating this dance between the two of us. So, when I stepped back and I stopped doing the things I was doing, um, acting the way I was acting out of my anger and resentment, it allowed him to breathe and actually be there for me the way he wanted to, and not the way that I was trying to control him to.
Yeah. You were able to break out of that pattern or negative cycle.
Mhm. Yeah, yeah.
That's really interesting. I think that's really important for other people to hear that sometimes the way we are in relationships keeps that pattern going. And when we change, the system has no choice but to change at the same time. It can't stay the same if we start to change, if we recognize our own judgments, if we recognize our biases, and we start to be more open or change those, the system will inevitably change.
Mhm. Yeah. And I think it continued. Like, I feel like even after I went through pelvic floor therapy, we were, intimate again, and we were trying naturally to conceive, and just wasn't working, for whatever reason. And I think we went on this journey of like, do we now go for fertility treatment? What do we do? I started to find myself back into that place of like, geez, so I cured one thing and now I'm going back into like this other thing of like, now I can't, like, why am I not getting pregnant? Right. It's like I had to continuously break out of that cycle and not let him, not like push him away during the journey. And I remember when we started IVS, I had told him, like, I can't do this alone. Like, this is you and me. Like, I know like majority of like the procedures is on me, but like you're part of this journey just as much as I am. So um, he took me to every appointment I had to go to. He would take days off. Like, it was just, I feel like I wouldn't have been able to go through that journey if he wasn't there partnering with me on it.
That's so important. A a lot of women end up feeling alone and want their partners with them. And I don't know if it's the couple's belief or one partner's belief that the non-birthing partner doesn't have to be in the room for the different appointments because it's not their body getting examined, but being there, being the emotional support and not going through that alone is so important for the intimacy of the marriage or the relationship, not just physical intimacy, but the emotional intimacy and feeling like a partnership.
Mhm. Yeah. And I mean, you know, as we are going through IVF, even pregnancy, there were a few times when I had to get the transvaginal ultrasound. And though I am okay with vaginismus, like, I still have pain every now and then. And I remember he would just advocate for me, and he would tell the doctor or whoever was doing, like, hey, she has this condition, or like she's going through this. So can you just take it easy with her? Like, and then he would tell me, like, you got to tell them if it's like causing you pain, and he would hold my hand. And it was just, I feel like because he knew what I was going through and like all of it, he was able to be there to be an advocate. Even the day of my birth, um, there was like I was just sometimes not there, and so he was able to advocate for me because he knew um, kind of my state of mind emotionally and also mentally and physically what I was going through and what I had been through.
The work that the two of you did to repair your relationship and strengthen that foundation before you got pregnant, I'm sure had so many impacts once the baby came and then you're sleep deprived and you're going through all the stress of being new parents. I always tell my clients, you want to work on these relationship issues before the baby comes because it's going to get 10 times more difficult to do it afterwards.
Mhm. Yeah. And I mean, I still went through my own issues, like through IVF, through pregnancy. I still felt isolated. I still felt alone. I still felt like he wasn't there, even though he was, right? Like, I think just on a human level, it's so easy for us to see what we don't have versus what we do have. Because we're constantly being fed that on a daily basis. Like, we're constantly being reminded of like what we don't have. And it's so easy for us to fall back into that sort of mindset of like, I don't have it. So I would keep thinking like, well, he gets to go to like the gym and work out. He gets to go out with his friends. Like, I'm like being left alone, right? Even though I knew that that was good for him and his own emotional state and like whatever it is that he needed to do to fill his cup up so that he could help me, I still felt that way. And even after birth, I went through postpartum depression and anxiety, which was another journey that we took together as a couple. But I remember there was a point where I was like, I don't want to do that to you anymore. Like I feel like I continuously like am bringing on so much like sadness into your life because of like my own, like my own sort of things that I'm going through. And I was like, maybe it's just better for us to just like split. And
Oh,
he just
that
like
hurts
looked
my
at,
heart just thinking about you going through that.
yeah, he just looked at me and he's like, I'm here. And he's like, I'm not going anywhere. He's like, anyways, if even if we split, like there's nobody else I would want to be with. So he's like, we're just gonna have to go through this together. He's like, you can either push me away or we can talk through it and we can get the help that we need. And um he also was going through his changes, right? Like he also was going through um his form of like, okay, now I'm a father and this is what I need to do. His own thoughts of like imposter syndrome and things like that, which I wasn't able to, be there to help him because I was going through my own stuff. So I think just being there for each other and just communicating what we're going through and knowing that we both equally needed therapy, needed help, needed to talk to somebody else that could help us through this was the best help that we could give each other.
Yeah. Even though you were on your own journeys, you were
Mhm.
still finding ways to come together to show each other that you loved each other, that you were there with each other.
Mhm. Yep. Yeah.
That's so important.
Yeah.
Often those first 2 years of parenthood, I mean, all the research says those first 2 years of parenthood are the most difficult on any couple. Raising young kids is so difficult. Because not just the kids, but also what you go through individually and as a couple and all those changes that come with it.
Mhm. Yeah. And I think for us, what has helped us is just keeping the communication open. So one of the things that we do is he has his own things that he loves to do. Um, and I have my things that I want to do. And every Sunday we kind of sit down and we kind of go through, okay, here's the schedule for this week. This is what I'm going to do. What does your schedule look like? Like if we have to figure out what the schedule is for my son, who's going to be there for him to do this or that. Um, And then we'll talk about like, okay, like what are some goals that we want to do? What are some things that we want to do together this week? Like we've really made that kind of a number one priority that we do every week so that we are able to give each other the space that we need to heal or like let go of whatever it is we need to let go individually and then be there for each other and then also be there for our son.
I love that strategy. In my work, I call those couples meetings and always recommend that couples do them once a week. Worst comes to worst, you don't have anything to talk about. You just spend 30 minutes, an hour having a cup of tea and finding a way to connect with one another.
Okay. Yeah,
But that
absolutely.
space is always together.
Yeah.
This has been so helpful. As we're getting ready to close up today, is there something that you suggest to almost every client that you work with, or you would want the listeners here to really think about or take with them from our talk today?
Yeah. So I work a lot in like the spiritual space, right? And I guess break any myth. The first thing that I just want to say and like really put out there is everything is energy, right? And so everything you're putting out or you're bringing in is a form of energy. And you kind of staying in the space of like creating stories or just like feeling like you don't have control over a certain thing is an energy that you are just continuously creating inside of you. And so to break out of that is to start thinking about ways that you can change that energy, release that energy, right? And so I always tell my clients like a thought or an emotion or even like you just like observing something, like all of that is energy. Just become very aware of like what energy you're in and what energy you want to be in, right? If you are not aligned to the energy you want to be in, you have control of changing that. That's in your control. You can choose to do what you choose to do. Um, that's not in anybody else's control. And so I think when I started understanding that and applying that to my life, that's when things started to shift. Like I still get into ruts. Just this past like week, I was back into like those things of like feeling very hopeless and like I don't know what to do. Like parenthood is so hard. Like I don't know if I'm like being a good mom, right? And I have to continuously remind myself of like staying in gratitude, staying in like the present moment, but also whatever energy I'm putting in with these thoughts is going to manifest into my reality. So either I kind of change that energy, I transmute that energy, or I just replace it with some other energy that I really want to be in.
Thank you. I think that kind of ownership of our experience and being able to say, okay, I can recognize where I am and this isn't where I want to be. How do I take the steps to move towards the energy that I want to put out there? How I want to interact with my partner, how I want to interact with my world. Those definitely have huge impacts on our state of mind and how we feel going through that journey as well.
Mhm. Absolutely.
That's so important. This discussion has been really enlightening, and I love to think about your journey from the challenges that you experienced to really finding yourself and finding your own awareness in this new energy and spirituality that you've been talking about, and how you've been able to keep that thread as you've gone through these different parts of your life, and really sharing that it's not a one-stop shop. You don't get there and all of a sudden you've walked through the door and you never have those issues again. This is a constant practice that you're having where things are going to happen, you recognize it, and you employ these strategies again and again.
Absolutely. Yep.
So if anyone listening here wants to be able to get a hold of you, what's the best way for them to do that?
There's a few ways. I'm very active on Instagram. So my Instagram is Inner Serenity LC. So my business name is Inner Serenity Life Coaching. Um, and so on Instagram, I'm always posting videos and content that's helpful. I also have a podcast called Soul Diaries, which I'm currently recording for the next season. Um, and then my website, which is www.innerserenitylifecoaching.com.
Wonderful. Thank you so much for sharing your experience and your knowledge with us. I'm sure it's going to help a lot of people.
Absolutely. Thank you, Rachel, for having me on the show.
I am so grateful to Urvi for sharing her journey so openly. Her story is such a powerful reminder that healing just doesn't happen within us, it happens between us in our relationships. If this conversation resonated with you, I encourage you to take a moment to reflect. Where in your own relationship do you need more connection, more patience, and maybe more understanding? And if you want to explore this deeper, please make sure to check out Urvi's work. I'll link everything in the show notes. Thank you so much for listening. If you've been nodding along during this episode thinking, this is exactly what happens in my relationship, but I don't know how to stop it, I made something for you. It's a free 7-day email course called Break the Cycle. Each day, I'll walk you through simple steps to stop the same fight from repeating and start rebuilding real connection without shutting down, walking on eggshells, or trying to do it all perfectly. You can sign up at my website. I'll link it in the show notes. It's totally free. This isn't just about communication. It's about breaking patterns that are breaking you. That's it for today's episode of Coupled With. Thank you so much for spending this time with me. If this episode resonated with you, I'd love for you to hit subscribe so you never miss what's next. And if you found it helpful, please share it with a friend or leave a quick rating and review. It really helps more than you know. And if you're curious about how we might work together or want more resources to strengthen your relationship, head over to my website, www.drrachelorleck.com. You'll find free tools, podcast extras, and ways to go deeper. Thanks again for listening, and I'll see you next time.